2, 1, go.
Okay, first I will start with hand hygiene before I enter. Okay, hello, I'm Michaela. I'll be your nurse today and we'll be doing a head to toe assessment. Could I get a first name?
Isabel.
And last name?
Claudio.
And what's your date of birth?
February 20th, 2002.
Okay, and do you have any allergies that we should be aware of?
Not that I know.
Okay, and are you feeling any pain? Okay, and if you were feeling pain, I would ask you on a scale of 1 to 10, 1 being a little pain and 10 being the most pain, how you were feeling. Okay, and then we'll start with me asking you for your name again. What's your name?
Isabel Claudio.
Okay, and then why are you here?
I'm here for an annual checkup.
Okay, and then where is here?
It's local clinic.
Okay. And what's today's date?
Today's date is April 24th, 2022.
Okay, so we just went over level of consciousness and you answered all the questions correctly. So we can move on to skin and nails. Can I have your hand? Okay, so looking at her skin, you can see that it's even. There's no discoloration, no redness. And then you can see that her skin on her hand is also even. And when you're palpating, you can feel that the temperature is even throughout. There's no random patches of cold. And then looking at her hands, you can see that her nails are 160 degrees. There's no clubbing. Her nail bed is even. And then when we do capillary refill, her nail refills in 2 seconds or less, which is what we're looking for. And then on your arms, we can see no anything here, but on this arm over here, we have a few moles. Have they ever grown in size or border?
No.
No? Okay, then we know that you are not at risk for any skin cancers. And then we can continue even further to looking at your hair. Okay, and then so I'm looking for any bald patches or irregularities in your hair. So far we see nothing. Your scalp has no damage, no dry flakes or parts. Your hair is even thickness, it's shiny and it's straight. And then looking at your face, we see that your face is even, your facial structure is symmetrical on both sides, your eyebrows as well. And your facial features, when you, there is no sign of pain and it matches to your pain assessment that you gave me. Okay, and then we can go ahead, if you could remove your mask, or actually first take your glasses off. Okay, I'm gonna be looking at your eyes, so eye assessment now, and we can see that your eyes are white, there's no sign of yellow. You have even eyebrows, eyelashes, and then when we look for pupillary reflex, so perla, look at my nose. Okay, I can see that when the light shines into your eyes, your pupils dilate, and when it goes away, it was the opposite. When your pupils dilate, there's no light, and when they're constricting, their light is shining in your eyes. And then go ahead and remove your mask, and we're gonna do a lower face assessment. Okay, and so when we look at your nose, we can see that there is no fluid coming from your nose. Your nose is even, your lips and your skin color and your skin are also pink and not showing sign of cyanosis or lack of air. Open your mouth, please. Okay, and we can see that, okay, so pretend this light is working. We can see that your mouth is pink, your gums are pink, your teeth are even. You have good moisture in your mouth. And then say ah, sorry.
Ah.
Okay, and then when you do that, we can see that the uvula is even, but it also moves a little bit. And then go ahead and smile. Okay, and then we can see that you have good muscle in your face. And then I'm gonna look at your ears. Okay, and we see that you have a single piercing in both of your ears. Okay, and then when we shine a light in your ear, pretend this is also working, it's broken. But when we shine a light in your ear, we can see that there's no sign of irritation, infection, or pus. How do you clean your ears?
I use Q-tips right after I shower.
Okay, perfect. And then we can do a quick. You can go ahead and put your mask back on. Yes. We can do a quick range of motion test. So go ahead, bend your neck down, and then go ahead, look at the ceiling, and then look side to side. Okay, and we see that you have a full range of motion with your neck, and then we'll continue on, and we'll look at your upper extremities. Okay, so when we're looking, we already went through the skin, but we can also tell that if you pinch the skin, it goes back. The skin turgor is good. Your elasticity is good. When we palpate, you can feel the muscle when I touch your skin. Do you feel any pain?
No.
Okay, that's good. And then on your other arm, it's the same. We just want to make sure that it's even on both sides. Okay, and then when your hands are down on your knees, go ahead and push up. Okay, I can feel like you are able to do that, so you have full muscle control, and you are able to use your muscle with resistance and gravity. Okay, and then we will do respiratory. Okay, and then so when we look at her chest, you can see she's breathing at a normal rate. Her shoulders are also raising at a normal rate, and then so if I push my hands down and lift your shoulders, you can see that she also is able to push up with that resistance that's pushing down. And then we can listen to her respiration. We're looking to make sure that there's no abnormal, adventitious breath sounds, and we can start from the right to left side, and we're going to go 6 paces or places, and we're gonna listen, and her anterior side, and we're gonna listen to make sure that all the breath sounds are even and that there's no irregularities. And then we're gonna go ahead, sit forward a little bit, and then we're gonna listen in her back side as well. Go ahead, breathe. And we're gonna do the same as we did in the front. And we're gonna compare left to right again. Okay, and then we can hear that she has unlabored breathing. She doesn't have any abnormal breath sounds. And then we can go and monitor for her heart. And then let me see your pulse. We'll do that real quick. Okay, so for the pulse rate, you can feel that it's not bounding, but it's also not weak. So it's a 3+ pulse rate, MRC. And then for your heart, we can also, we'll do 8 to man. So we'll start at apical, right here, to pulmonary, to tricuspid, to mitral valve. Oh, and Erb's point right there. Okay, so we'll start. And then I'm just gonna have you just relax. And so we'll start on her left, on her anatomical right side actually. And I'm listening for any heart murmurs. Okay, go ahead, sit back a little bit. We'll go on. Okay, yes, so there's no heart murmurs, so her heart rate is even, steady, there's no abnormal sounds for that. And then we can check for carotid pulse and any distension of that vein. And there's none, and we'll check on either side, but at separate times. So we can feel that that is also normal. There's no bulging or anything. And then we can check your gastrointestinal. And then so I'm gonna look or inspect. Pretend that her shirt is pulled up in a normal assessment, but for this sake, it will remain on. And so we would look for any lumps, bumps, or tenderness. And then right now we don't see any, so we'll go ahead and palpate from the lower left quadrant or right quadrant, and we'll palpate in several areas, and then we'll move up. And are you feeling any tenderness as I push on your stomach?
No.
Okay, and then we'll move to the upper left quadrant and palpate there, and then we'll move to the lower right quadrant, or left quadrant, I mean. And then any tenderness there?
No.
Okay, so she feels no tenderness. I don't feel any bumps or lumps or anything of abnormality. And then we can go ahead and check for her range of motion in her leg. So go ahead and kick your leg out. Okay, that's good. And then the other one too. Okay, so we see that she has good range of motion. And then go ahead and pull your pant leg up. And then we'll inspect her her skin on her leg. And on this one, you can see that her skin is clear, it's even. Oh, she does have a bruise. And has that been healing well? Okay, then we're all good with that. And when I touch it, it feels warm, but not too warm. No signs of fever, and also no random spots of coldness. So we're good, and it feels even, smooth, nothing out of the ordinary. And then go ahead and go ahead and move your leg or your feet up, and then go down. Okay, and then we see that she has good range of motion with her ankles. She has nice plantar and dorsiflexion. And then when I walked in, I saw that she had normal gait. She is clean and hygienic, so she doesn't have any problems with that. And that will conclude our head to toe assessment. Is there anything you would like to ask?
No.
Okay, then the doctor will be with you in a second. And then when I leave, I will do hand hygiene, and that will be all.